So, Rex, thank you so much for meeting with me today. We got to explore a little bit about what's going on with you right now, and I know it's difficult to talk about, so thank you for being willing to share with me what's going on. We talked about several different things today. We did talk about your need to find that more permanent, secure housing, so where you can somewhere where you can be and feel like it's your own
Hmm.
space. We also talked about access to food, so you're not worried so much about where the next meal's coming from.
Hmm.
Talked about getting some new work boots for work and also some glasses. Lastly, we talked about your mental health and the toll that all this stuff is taking on you. So, all of the things that we talked about today, which things do you think are the biggest priority? What would you like to focus on first?
Um, I mean, the boots would be nice, but they're work. I mean, they can work for now. But really, the glasses, these are falling apart, and it's going to be hard
Yeah.
to do the work if without being able to see. And so that might be a good thing to get taken care of first.
That makes sense. It's kind of hard to do anything if you can't see really well,
Yeah,
right?
yeah.
Yeah, absolutely. Well, that makes sense. I mean, there's a lot of things we want to work on. Obviously, we can't fix all of those today, but it sounds like getting the glasses done is your big priority, so let's work on that. Here's what we can do. My job is to offer you some resources, hook you up with some places where you can get those things taken care of, and then your job is to follow through with that and check in with them. So we'll make sure that you get those resources before you leave here today. And then before we meet next time, I would like for you to reach out and see what that looks like as far as getting an appointment and getting set up to get your glasses
So
handled.
you can tell me like where to go.
Absolutely.
Okay.
Absolutely. We've got
Okay.
a list of resources that we know will work for you.
Okay. All right. So then what are we doing? So we get that, and then what about the rest of the stuff?
Absolutely. So I'd like to set up some regular times for us to meet. I know you're trying to get your work schedule set up and get in as many hours as you can. What seems like a reasonable time for us to meet again? Should we meet again on a weekly basis? Does that
Yeah,
feel
yeah. I mean, I don't want this stuff to take forever, so yeah. Why don't we?
right?
That'd be good. Yeah. Let's not wait forever.
Right. Definitely within the week. If you feel like you'd like to come in sooner, we can set up a time sooner. But I feel like a week will give you time to set up an
Yeah.
appointment for your glasses.
Yeah.
And I would like to check in with you about once a week while we're
Okay.
working on these things.
Okay.
Does that feel okay for you?
Yeah. No, I think that. Yeah, because I want to get this stuff going. So that make. Yeah. Let's do that.
Okay,
Yeah.
let's do that. So when we meet on the weekly basis, we'll be checking in with whatever it is that we've set as a goal for that week. And as we keep working together, we'll keep working through your priority list and make sure that you get the things that you need while we're working together. How
So
does that sound?
start with glasses, and then my place.
That if that's is that your next priority? Does
Yeah. I
that
mean, I
feel
think
like?
we got to. I mean, we got to get me my own place where I can, take care of my business. And so, yeah.
Okay. So glasses first, and then we'll work on getting a place, and then we can kind of we'll go from there.
Okay.
Does that sound good?
Yeah.
Okay.
Yeah.
I want to make sure that we're meeting your needs, right? You are the expert on how things go for you and what's most important for you. And my expertise lies in knowing what community resources are there to help you and to get you what you need. So I think working together, we're going to get there.
Okay.
How's that sound?
All right. All right. Let's give it a shot.
Okay.
Thanks.